Today we are at Arizona Chiropractic Neurology Center. Let's go meet Dr. Russell Teagues. So when choosing your professional health team, it's really important to have somebody that has a great energy and a natural philosophy. I would like to introduce you to Dr. Russell Teagues, and he has saved me many times. So, Dr. Teagues, would you say that pain or loss of function brings more people to you?
Well, that's a good question, because in the line of work we do as a board-certified chiropractic neurologist, we find kind of an overlap between pain, but also what initially caused that pain. For instance, if there's an autoimmune disease that's ultimately causing inflammation and pain, or a concussion that's causing head and neck pain, but the cause is more of that neurometabolic problem, a lot of people do come in for pain, yes, but that cause or the original insult is often something completely different.
How do you track where that's coming from? Tell us how you perform your magic.
Oh geez. So ultimately we start every patient out with an evaluation, and so the evaluation is a little bit different, and I think it's what sets us apart from other facilities. What we do is we use a video nystagmography, or long-term, or what we do is we use a video nystagmography, which is a big long word for cameras that capture eye movements. And based on these eye movements, we're able to determine where in the brain may a problem be. And so when we do that, it allows us to really hone in on the therapies that we can use or that may work better than others. And in addition, we use lab work from the basic metabolic labs to comprehensive labs to autoimmune panels to specialty testing looking at GI-related issues, the cortisol adrenal complex, any hormones, or other specialty testing like leaky gut, autoimmunity to brain, and other things like that.
Okay, so this is really apropos or appropriate for patients suffering with MS because of the brain. But let's talk about this brain-gut connection.
Yeah, that's a great question, or a great point you bring up. The brain-gut connection is one of those things that I'd say most people don't even think about. So there's two big nerves that go from the bottom of the brainstem to the gut, and it's a superhighway. It goes from the gut to the brain, from the gut to the brain, and the brain to the gut. It's called the vagus nerve. So the vagus nerve is really one of the longest nerves in the entire body, and it transmits not only signals to keep your gut healthy, but it also transmits things like neurotransmitters up to the brain, as well as feelings of the GI, the torso, the guts, to the brain, so that you can know what's going on down there. And when the brain is injured or there's inflammation in the brain, you lose that connectivity from the brain to the gut. Therefore, you start losing gut function, and then you start losing that gut-brain axis. So if the brain's on fire, the gut's going to be on fire. If the gut's on fire, the brain's going to ultimately be on fire. And so we evaluate that throughout our physical exam, throughout the history, and just something as simple as looking at a dietary journal can really be of great use or great investigation when working with patients with especially autoimmunities.
So it's very common as you age with multiple sclerosis that inflammation develops. And I know you pointed out to me on one of my visits that you were seeing high levels of inflammation. Talk about that. Inflammation would then really affect those vagus nerves, right? And the other nerves in the body.
Yeah.
Let's talk about that.
Absolutely. So inflammation actually activates the pain receptors in the entire body. So when you have inflammation, it's not just going to be in one spot. Think like the house, for instance. Let's say the kitchen's on fire. Well, it's not the fire that often destroys, like it may destroy something local, but it's the smoke that destroys the entire house.
Right.
So in the body, when you have an inflammatory reaction, say in the gut, that's going to send the smoke or inflammatory cytokines throughout the entire body. And so what feeds your thyroid or what feeds your nerves is also going to feed your brain, your gut, all your muscle tissue, your skin, all these different things. So when you have inflammation present, whether it's from food or from an injury or a genetic susceptibility, all these things that are impacting us on a daily basis, from toxins to relationships to stressful environments, those impact those those genes, and then whatever else is is creating that inflammation. That's what's making the change in the brain or the gut. So really, anytime we do rehab, we have to do a brain-gut, gut-brain type of approach, decrease inflammation, address toxins, look at genetic susceptibility in some cases. So it's really an entire well-rounded approach versus either a brain-based approach or a metabolic approach. We try to combine the two so that we really have the best bang for our buck.
So here again, we're seeing a doctor that has the attitude of looking at the whole body, looking at the mind, looking at the soul, and looking at the physical body because it's so important. Now I know he has saved me so many times when I've come in with knots in my neck or in my back, and they have been causing pain and discomfort to me. But it has always stemmed to another cause that he has so effectively been able to find and relieve that pain and discomfort. How important is it that somebody with any kind of chronic disease pays attention to those signals, to those pain, and drives them in to see a professional so you can help relieve those symptoms?
I'm glad you said that pain or whatever it may be is a signal, because that's exactly what it is. You know, on your car, when you have a check engine light come on, there's so many things that it could be. And if you don't address that pretty quick, the next thing you know, there's a next light on, and then the next light, and then the next light. So really that check engine light, or in this case it could be pain, digestive issues, sleep problems, inability to use a muscle very well, all these different things are signals that something else is wrong. So ultimately, what you're going to want to do is not sit on those symptoms. You bring yourself in just to have yourself checked out. Go to a reputable doc, go to a reputable practitioner, anyone who is holistically minded, and they can more than likely direct you to what needs to be done early on. Because if you think about it, the longer you go, the worse that engine's getting, the more it's going to require to repair it. So if we can really get our hands wrapped around you and our teeth sunk in to that early on problem and uncover that cause, it makes our job so much easier, but it's going to make your life that much better. And as we educate you, you can take that education and apply it to your life so you don't have to work with us on a regular basis when that chronic disease typically sets in.
Just last week I was in, and even though I was complaining about muscle pain, doctor examined my eyes, followed my eyes, recommended a breathing treatment or a concept on how to breathe correctly to address some of the stress that I had been handling in my life. Explain that to me. Why did you do that?
So when you breathe, long story short, you're trying to bring in oxygen, but of all of the oxygen you're bringing in maybe 15% of the total air. The other things are nitrogen and CO2. So ultimately, with a high percentage of CO2 coming in, you're trying to bring in that oxygen, blow off the CO2. So what we're doing is a 4-4-8 breathing pattern, and then we start to layer brain-based therapies on top of that. So when you're stressed, or when anyone's stressed, you can use this 4-4-8 breathing, 4 in through the nose, 4 hold, and then 8 through the mouth, or like pursed lips. And then you're going to want to tag the happiest memory possible. By tagging that memory, you're activating certain neurotransmitter activity as well as different areas of the brain that supersede that stressful pathway. And so by doing that, we have you breathe, we have you tag these emotional thought processes, and then we actually give you specific eye movements based on what you had going on, which are going to activate that part of the brain that's going to take that therapy to the next level. Almost like creating the physical, emotional, and autonomic and respiratory in your case to help you work with and overcome some of that stress you were dealing with.
Do you see that stress is a leading cause of a lot of the issues? Okay, talk about that.
It's these days with the news, I'll use as an example, but it really everywhere you're looking, there's something going on, and it's really spreading of bad news or a bad review or something. They say bad news travels like wildfire. So when this is chronically or constantly bombarding us, pretty soon we get in that fight or flight mode and we can't get out of it. And I'd say 90 to 100% of my patients have that fight or flight mode, or that's mode, that mode is what caused their initial insult or the catalyst for whatever they're dealing with now. And so that creates more susceptibility on top of toxins, all the things we mentioned before. So you really have to address every piece of the puzzle, not just the breathing, not just the stress reduction, but now everything else that's worsened because of that initial stressor.
Okay. So we know the immune system resides in the gut, and with autoimmune diseases, how important is diet and nutrition and hydration to well-being?
That is probably the most important thing. If you're not going to change the way you eat, you're going to have a very tough time taking supplements to try to heal yourself. Working with the gut is number one, taking away the most common infiltrator or the most common sensitivity or most common trigger is food. So nowadays, with all the radiation in our foods, all the chemicals in our foods, all the changing and genetically engineering and genetically modifying of foods, it makes it harder and harder for our body to actually digest it. So the better you can shop, the cleaner you can shop, you're still going to be bombarded with some of these toxins and things, but the better you eat, the less amount of destruction is going to happen. So it's going to make your life easier fighting that uphill battle. And so we always start with dietary changes, and when patients can or cannot tolerate it, we add in supplements, because that's what they are. They're a supplement to a nutritional change. Some people cannot do that, or they would like the little extra oomph to try to help them get to their goals.
Right. So when we maybe eat too much sugar or carry too much weight, that is actually creating a worse problem with the inflammation. Am I understanding that right?
Yes, you are. So body fat by itself in accumulation is call it a different color of body fat. There's two different kinds, but ultimately the adipose tissue throughout the GI system, so the abdominal fat, is one of the most commonly inflammatory components of excess sugar. So when you bring in sugar, it really destroys your entire hormonal system. It activates the inflammatory system. It throws off your insulin regulating blood sugar system. It throws off the cortisol system. It's really the number one thing that we try to regulate. It goes blood sugar, anemia, and then inflammation, and then the immune system after that.
So does aging and inflammation build up in the body? You said it can affect the hormones, then it affects mood, right?
Sure. So not only do your mitochondria begin breaking down at the age of about 30, that's a normal process, but our goal is to try to keep that breakdown slowed to the best, or I guess to the slowest possible rate. And antioxidants can help with that, but oxidation is really that whole process. So as you are eating more inflammatory, as you are trying to do healthy things, make sure that you're really educating yourself to keep that breakdown from happening. So to maintain the young age, so to speak, or the fountain of youth, you really got to kind of sink your teeth in and evaluate the things that are going into your body.
Okay.
Go ahead and ask that question again. There's like two parts to that.
Okay.
Sorry.
So as you age
Mhm.
and as you put on weight,
Mhm.
then that is actually compounding the inflammation problem.
Absolutely. Okay, so the second part to that question is adding of the weight. Typically, that weight change is often a blood sugar inflammatory cascade. Those together make changes to the hormones, which then can change mood. Ultimately, when you have too much sugar, which is probably the most common thing we see, insulin resistance and things like that, is you actually turn men into women and women into men. So you have this total change in the way that the brain reacts or acts at that point, which can cause anxiety, depression, emotional disturbances, can allow stress to go through the roof. And that's when you really start getting that brain impact, which ultimately becomes a vicious cycle. And so when you're talking about blood sugar, weight, mood changes, you're looking at insulin, cortisol, hormones as well as neurotransmitter activity, because you need stable blood sugar to get all your amino acids into your brain to create those neurotransmitters. And a high number of those are created in the gut too. So increase in blood sugar, increase in insulin, increase in inflammation is going to destroy the brain and the gut pretty much equally.
Okay. Now I know about 2 years ago I had a bad case of the flu and it really affected me. And at that time they had told me, you're going to have to exercise almost every day of your life now to keep your function and your activity. I exercised because it was a lot easier than changing my diet.
Mm-hmm.
But I found I didn't get the end results. I got in shape, but it didn't take the weight off.
Mm-hmm.
I had to go ahead and change my diet.
Mm-hmm.
Over the last 4 months, I changed my diet. I dropped 32 pounds. And I'm noticing things as the body pain went down, the amount of headaches went down. But interesting factors, I no longer had to get up during the night to go to the bathroom. There was an urgency.
Mm-hmm.
And so when you say whole body function,
Mm-hmm.
you're not exaggerating, you're telling the truth. It really affects your whole body.
Mm-hmm.
So it's really important with anybody with chronic disease that they manage their diet, their exercise levels, and their weight as they age.
Absolutely, absolutely. So, like most people go to the dentist once or twice a year. I'm guilty, I only go once a year, but ultimately when we look at the whole body, we want to do those check-ins. Usually, at least I like to do them quarterly. Like in fact, I do a liver detoxification quarterly. That keeps my body functioning quite well because I have a genetic predisposition to load up on toxins. And if we're getting our teeth checked once or twice a year, I am so surprised that we don't have people visiting a neurologist or a functional neurologist or a chiropractic neurologist to evaluate their brain, or a functional medicine expert trained in gut health, right? We need to have these components working on the same page in order to maintain that health that you're talking about, so that you can keep your diet straight, so that you can keep your hormones in check, so that you can keep your brain in check or performing optimally so that you don't have any of those symptoms.
Now, I know when I first came, I was referred to you by a massage therapist, a member of my health team. And is chiropractic neurology kind of a new field?
New in the essence of healing, no. That's been around for a long time, thousands of years. The application of neuro rehab is, I'd say, a little newer. It's about 35 years old. It's taken all the neurological pathways that we know of, and it's given us ways to activate them without drugs or surgery. So where a neurologist or a neurosurgeon may implant deep brain stimulation in the frontal lobe or the basal ganglia for something like Parkinson's, what we would do, we would actually use different head, body, and eye movements or even thought processes in order to help activate certain parts of the brain to either put the brakes on or increase the gas for whatever issue they may be dealing with.
And so this is really treatment that you can have with no side effects.
Absolutely. In many cases, we don't make the claim to cure anything, but what we do is try to activate or provide a therapy that's going to promote optimal function in whatever region of the brain or body that we can affect, whether it's a spinal adjustment, a thumb adjustment, laser therapy, nutritional change, vestibular therapy, anything that can activate that area that we find on that initial examination to create optimization is our major goal.
So he refers to optimalization,
Yeah.
but it's what I call authentic health. Dr. Teams, how would you like to close up today?
I would like to say, really, something we touched on earlier. You didn't say it, but I was thinking it as you were saying it. You are what you eat. Start with the diet changes that promote optimal health. That's going to be the baseline that you're going to be able to take with you throughout your life. If you use something like Authentic Health or other practitioners that you know to help educate you, take that information, run with it, get your brain checked out, get your spine checked out, be happy, be grateful for what you have, and just love life every day. That in itself can change so many things for the better. I can't even tell you how many miracle stories I've seen just from people changing their perspective.
So you can see why I like having good-looking doctors on my team who take care of me.
Oh, geez,
Thank you.